Assalamu alaikum. The long clinical consultation day with Mr. Ronaldo, 32 years, referred from the GP with high blood pressure. Okay, ready?
Yeah,
Here you go.
yeah. Hello.
Hello.
I'm Dr. Mudassir, one of the doctors working in the clinic today. Is this Mr. Ronaldo with me?
Yeah, I am.
Okay, nice to meet you, Mr. Ronaldo.
Thank you, doc.
Okay, I just wanted to confirm your age. Can you please tell me your age?
Yeah, I'm 32 years, doc.
Okay, Ronaldo, today we are going to discuss about your medical condition. I'm going to gather some notes and going to examine you, and I hope in then I'm going to answer all your concerns. Is that okay with you?
Yeah, doctor, please.
Okay. So can you please tell me what brought you here today?
Yes, doctor. I have been diagnosed with hypertension, high blood pressure since almost 6 months now. And
All
my
right.
GP, yeah, I went to my GP many times, but
Mm-hmm.
still he couldn't understand what's ongoing with me.
Okay, I'm sorry to hear about it, Ronaldo, and definitely I'm going to help you in this regards. But I just wanted to make sure before 6 months, you were completely fine.
Yeah, doctor.
Okay. What symptom, what signs, and what complaints you were having when you were diagnosed as the high blood pressure?
Actually, it started by headache,
Mm-hmm.
and he gave me uh, he measured the blood pressure, and he found that it's high. Then he gave me some instruction about food and exercise,
Mm-hmm.
but actually it didn't help with me.
Okay. Are you compliant with the instructions he told you?
Yeah, doctor, I'm trying my
Okay.
best, but still, when I went to him in the follow-up, he
Mm-hmm.
checked my blood pressure, but he found still high.
Okay. Can you exactly know the reading of your blood pressure?
Yeah, it was 160 over 95.
Okay. And what medication you are taking currently?
He prescribed for me medication called amlodipine or
Okay.
something like that. Yeah.
Okay, and how much dose you are taking? Is it 5 milligram, 10 milligram? Any
Yes.
idea?
He gave me first five.
Okay,
Then when in the follow-up, he found again the blood pressure high, so
mm-hmm.
he increased the dose to 10.
Okay, and for how long you are taking this 10 milligram?
Yeah, for almost now 2 months.
Okay, any other medications you're taking apart from this?
No, doctor.
Any over-the-counter medications?
For the headache only, doctor, I take some Brufen.
Okay, can you tell me more about your headache?
It's dull aching all over my head, doctor. It's no particular
Okay,
area in my head.
okay, and it has started before 6 months, as I got from your history.
Yeah,
والله
yes, yes.
هاي بس
Okay,
حولت
before,
اللي نحول الصراحة.
okay, okay. Is it associated with any other symptoms like a throwing up or some nausea, sickness?
Initially, doctor, yeah, initially
Mm-hmm.
was, but nowadays, no, no, it's not associated with this.
Okay. Are you still having the headache currently?
It's on and off, and when
Okay.
I have the headache,
Mm-hmm.
I'm reading the blood pressure or measuring blood pressure. It shows
Okay.
high,
All right.
but in
Okay.
between,
Any
it's
vision?
okay.
All right. Any vision changes along with this?
Yeah, doctor, I feel some blurry when the blood pressure is high also.
Okay. And this blurring is in any specific part of your vision, in the central part, in the side part of your
No,
vision?
no, no particular zone.
Okay. Okay. Apart from this, do you are having any weakness in your arms and legs?
No,
Any numbness in your arms and legs?
no,
Okay. Any difficulty in swallowing?
no,
Any speech difficulties?
no,
Okay. Did you experience any weight changes?
no, doctor.
Okay, all right. And I wanted to just make sure what is your BMI to make sure to see you that are you overweight or are you obese or
Yes, it's around 32.
It's around 32. All right. Okay. Is it recent or you have been like this from a long?
And since long time, I'm the same, doctor.
Okay. Did you experience any high body temperature along with this?
No,
Any lumps and bumps in any part of your body?
no,
Okay. Any joint pains associated with it?
no,
Any rashes? Skin changes?
n- no.
Okay. Do you feel any awareness of your heartbeats along with this headache?
No, doctor.
Okay. Any movements in your hands, like some type of uh, tremors, if
Shakiness?
you understand, shakiness? Yes.
No, no, doctor, no shakiness.
Okay. Any chest pains?
Yeah, doctor, sometimes, yes, when the blood pressure also high, I feel
Mhm.
some chest pain.
Okay. Do you feel any change in the color of your face? Any flushing of the face with this?
No,
Okay. Any shortness of breath?
no,
Okay. Any cough?
no,
Okay. Did you experience any changes in your size of your hands and feet? Increase in the size of your hands and feet?
no,
Okay. All right. Okay. Any tummy pains?
no,
Any changes in your bowel habits?
no,
Any change in your waterworks?
no,
Any frothiness?
no.
Okay. All right. Okay. So have you been, I'm going to ask you a few more questions regarding your health. So any past medical conditions apart from blood pressure you have been diagnosed with?
No, doctor, only blood pressure.
Okay. Any family history of the similar conditions in your family?
Yes, doctor, my father was hypertensive and my mother was diabetic.
Okay. Okay. All right. All right. Any history of cancer in the family?
No,
Okay. You told me that you are taking just this amlodipine. Just wanted to confirm. I'm sorry to ask you this question. Are you taking any recreational drugs, party drugs?
and occasionally, doctor, I am.
What do you mean by occasionally? Can you tell me?
Yeah, at the weekend sometimes, doctor, if we have celebration party,
Okay.
yeah, we
All
are
right. Okay.
going, yes.
Okay. All right. Do you smoke?
Yes.
Okay. For how long and how much?
14 years, 5 cigarettes per day.
Okay. So I would like to inform you, Ronaldo, that smoking
Mm-hmm.
in whatever amount is injurious to health. And I would advise if you can just stop it, we can refer you to some clinics also. All
Okay,
right.
thank you. Yeah, sure,
Okay. Do
doctor.
you take alcohol?
Yes, at the same, occasionally, only doctor socially, when we
Okay.
have
All right.
party.
Okay. And do you do binge drinking?
No, doctor, no.
What are you doing for your living, Ronaldo? If you don't mind asking you.
Yes, doctor, I am a driver,
You are a
taxi
driver.
driver.
And okay, do you think this is affecting you? You have some blurring of vision, you have some headache.
Yes, yeah, doctor, you're right. Sometimes I feel blurry while driving.
So I would advise you that for a time being, you should start driving. It's not even safe for your health and for other people.
Mhm.
All
Okay,
right. Okay.
sure.
So how is your diet? What do you eat for your? I'm sorry to ask you. How is your diet? What do you take in
Yes,
your food?
doctor. Yeah, I'm trying to be following the diet region. However, doctor,
Yeah.
most of my food is from restaurant and spicy food like that.
Okay. All
Junk food,
right.
doctor, yes.
Okay, we will tell you regarding this also, to how to
Mm-hmm.
modify your diet regarding your weight
Uh-huh.
also. All right. Okay.
Okay.
So I'm sorry to ask you this question. I have to ask everyone. Are you sexually active?
Yeah, doctor.
Do you have a stable partner?
Yes, doctor.
Okay. No other partners apart from this stable partner?
No, no,
Okay. All right. Any travel history recently?
no,
Any history of blood transfusion?
no.
Okay, Ronaldo. Do you want to add anything you think I missed and you wanted to add for me?
Um, I think, doctor, no, nothing to be added. Yes.
Okay, Ronaldo. Is it okay if I can examine you now?
Sure.
Okay, so I would start from your just a general look for the patient from the bed end to see. How is he looks? He looks obese, overweight. His BMI is 32, as you
Yeah,
told me.
yeah,
Okay,
overweight.
so he's overweight. Okay, I would like to see the if there's any specific place the fat is deposited in the abdomen, in the tummy, or in the face, or does it is
Excellent.
similar all over?
All over the same. No, no particular area of fat distribution.
Okay, I would go close to the patient and I would like to see in the hands any signs of palm erythema. Okay,
No,
any anemia, any clubbing,
no,
any increase in the size of the hands by comparing my own hands.
no.
Okay, I would check the pulse for the patient. Is a
Yeah,
normal volume,
it's 85, and the
regular.
volume is, yeah, regular and synchronous to the left arm.
Mhm,
You should
mhm.
compare. And
Okay, yes, I will compare.
the
Yes. Any
yeah,
detail
the
delay?
pulse. No, no delay. Excellent.
Okay,
Okay,
I
and
would like to tell me.
yeah, the pulse volume is normal.
Okay, okay, I would like to
Okay.
go up to check the blood pressure in both arms.
Yes.
What is the current
Yeah.
blood pressure?
160, 95 in the right,
Left.
155 over 90 in the left.
Okay, and any history? I have postural hypertension. I would like to check for the postural hypertension. Any drop in the blood
No,
pressure?
no.
Okay, I would like to check for the proximal myopathy.
Yes, nothing. It's
Okay, I
okay.
would like to go to the eyes to see for
Mhm.
any signs of. I would like to see visual acuity.
Yes, he can see the
It's
chart.
normal. It's intact.
Yes, no.
Okay, it's intact. Okay, visual field, any bitemporal heminopias or any homonymous heminopias,
No, all fields intact.
all fields intact. Okay, I would like to do the fundoscopy for the patient because it's hypertensive to see
Excellent.
any sign of hypertensive changes.
Yeah, what you expect to find in the
I
fundoscopy?
can find cotton wool spots, flame-shaped
Excellent.
hemorrhages. It depends upon the type of the type 1, type 2.
Yeah, you can see cotton.
Okay, I can see
What?
cotton.
Yeah,
All right. Okay. All right. From there, I would like to see any pad of fat, the neck circumference, any interscapula pad of fat,
no, nothing.
any facial flushing, any mouth sores or
No,
cyanosis.
no.
Okay, in the mouth. Okay, I would like to go in the tummy to look for any signs of tummy distensions, any tenderness in the tummy.
Excellent. No, nothing.
Okay.
What else you want to examine that on?
I would like to see for the kidneys, palatable kidneys.
Excellent. No palatable kidneys.
No palatable kidneys. Okay. I would like to check for the radiofemoral delay also. However, there's no difference in the blood pressure between both
Excellent.
arms.
Okay.
Okay.
No, the different. Yes.
Okay. I would like to go and check for the pedal edema.
Before going to the leg, anything in the abdomen you want to do?
Okay. So I would like to listen for the renal artery stenosis bilaterally.
Excellent.
Dewey.
Yes.
Tamam, Dewey.
But
Okay. And
nothing.
also
Yes.
aortic
You're
brewing.
right.
Nothing.
But
And also
nothing.
aortic brewing.
Yeah.
If I can listen to the aortic pulsation and the aortic brewing.
Excellent. All
Okay.
nothing. Mhm.
Okay. So I would like to ask you, Ronaldo, what is your concerns?
Yeah. 2 minutes remaining. Uh,
Yeah.
Doctor, why I have this blood pressure reading continuously high even after take my
Yeah.
medication?
Yeah. I can completely understand. I highly appreciate your concern. I know it's very difficult for you, but for the time being, as I done your examination and the history, it looks like you are having a condition which is known as it could be blood pressure, which it could be primary, means there is no other cause because you have a family history positive, and because
Ex
you are overweight, plus you are having and very your lifestyle is not healthy. You're eating a lot of food
hmm
from outside, so probably this could be the reasons. But still, because Ronaldo, you are at a young age, so we would like to rule out other causes by doing some
hmm
test for you and some imaging for you to make sure we are not missing anything for you because you're already on medications and this is not affecting you. Are you
Okay.
clear up till now?
Yes, yeah, I can understand, doctor. Yeah, so you will admit me, doctor.
Yes, for the time being, I'm going to admit you because continuously you're having high blood pressure. I'm going to involve a team of doctors, which is going to be a general physician. It could be a cardiologist also to adjust your blood pressure medications and nurse. and I'm going to
What
monitor your blood
cardiologist,
pressure
doctor?
regularly.
Who's the cardiologist?
It's a heart doctor. I'm sorry, a heart doctor, a
Uh-huh.
general
Okay.
doctor, okay, and who might done do some tests for you further, okay, like we're going to do some blood tests for you. We might do a heart tracing for you and heart imaging for you, okay, uh, and continuously monitor your blood pressure so that we are sure that what medications we can give you further. We can done some imaging for your tummy also to make sure. Any other
Okay.
concerns you have?
No, doctor, it's clear so far.
Okay, so
Okay, time is up.
currently, yes.
Yeah. Okay. What advice you want to give him
Yeah, I need to give him
if you have?
lifestyle modification advice. It's very
Excellent.
important.
Okay.
He has to stop
Mm-hmm.
smoking. Yeah. Okay.
Excellent.
So
And
he has to stop smoking. Even
and
he's taking little amount of alcohol, he should stop it. He should
okay, okay,
take light. He should stop outside food. Stop
and
driving, as I told him before.
excellent.
Okay. And he
Yes.
should stop
Okay,
eating
that's
outside
enough.
food. Yeah. Okay.
Yeah. Yeah, that's enough. Great. Okay, let's go to the examiner question.
Mhm.
What do you think this patient had?
Okay, this is 32 years old, Mr. Ronaldo. He came with a recent complaint, 6 months history of headaches, which comes intermittent along with some intermittent chest pains. Whenever he has headache and they measure it, he has found to be have high blood pressure. No other positive clinical history apart from this headache and chest pain. Okay, and he is obese. On examination, he is a chronic smoker. Examination, he is obese. He's got high blood pressure in both arms. There's no differentiation in the blood pressure in both arms. No radioradial delay, no radiofemoral delays. Okay, and apart from this, there is no other positive clinical findings on his examination. Um, okay,
Okay,
so my differentials for high blood
excellent.
pressure on the first is going to be a primary hypertension, essential hypertension. Okay,
Excellent.
uh, but because he is a young age, so I would like to rule out other causes like pheochromocytomas, Cushing
Excellent.
syndrome. It's very less likely, but he's young, so I should rule out all these causes for him.
Okay. And why you ask for the
B,
BMI?
okay, because BMI usually Cushing syndrome can present with high blood pressure also. That's why,
What
and
else?
plus, if it's not BMI, if it's not Cushing, is generally because his lifestyle and obesity can cause him to have high blood pressure. This is one of the risk
Yeah,
factors.
what's called?
What is called metabolic syndrome.
Excellent. Yes.
Yeah,
Okay,
diabetes,
so
hypertension, dyslipidemia.
yeah, excellent. So this is another differential.
Yeah, it's another dimension.
Okay. Uh, how to investigate this guy?
Okay, so we'll start from some general investigation and some specific. General investigation will be like a complete blood count, in which I would like to see for polycythemia because he might have high
Excellent.
hemoglobin, which is one of the reasons for high blood pressure, and thrombocytosis. Okay, some of them are myeloproliferative disorders. However, there's no history, but it could be one of the reasons. Tamam urea creatinine electrolytes because this patient is young, so I need to see his creatinine because renal artery stenosis can cause high creatinine. Okay, electrolytes in the form of hypernatremia, hypokalemia, even Cushing syndrome, even what you call adrenal, I think, which causes high hypernatremia. Tamam. Uh, uh, Apart from this, I would like to do his LFTs, liver function test. Okay, and some specific investigations in the form of I need to do is ultrasound kidneys. Okay, to rule out any polycystic kidney diseases.
Okay,
However, there
okay.
is no.
Before going to the image, and yeah, as you
Hmm.
said, there is some specific investigation you want to do to rule out some other cause. What do you think?
Yeah, yeah. If I'm thinking of pheochromocytomas, I would
Excellent.
rule out 24 iodine metanephrines for him. Okay, and
Mhm.
there is one specific scan for him, MIBG scan. I'm not sure about the name, so we can rule out pheochromocytoma from that. Raised
PET scan, you
isotope.
mean?
It's a
PET.
MIBG scanning.
Okay, yeah.
It's
Okay.
specific for
Uh,
pheochromocytomas. Apart
yes,
from this,
okay.
I would like to do an ECG for him to say rule out signs of left
Okay.
ventricular hypertrophies.
What test you want to do, or the test can differentiate between the renal artery stenosis, or the other
Yeah,
causes of the renal.
yeah, yeah. I need to do your aldosterone levels and aldosterone renin
Excellent.
ratio for,
Yes, this is the one.
yeah,
Insulin ratio, yes.
yeah.
Okay, urine dipstick you want to do?
Yes, urine dipstick could rule out any proteinuria, any
Mhm.
hematuria, because glomerulonephritis can present with hypertension. However, he has no other features of glomerulonephritis
Okay,
and proteinuria for nephrotic symptoms.
okay. Image, you said there is image you can do.
This is what? Again?
Image scans. What's
Yeah, image
radiological
scan.
investigation?
Yeah, yeah. First of all, I would like to start with an ECG to see left ventricular hypertrophy and
Excellent,
echocardiogram to see for
excellent.
any changes in the valvular changes
Mhm,
or any structural change in the heart because of hypertension. Okay. Um then after that, I would like to go for an ultrasound kidneys for him. Okay. It can
mhm,
give me an idea of polycystic, plus it can give you an idea of any renal cell carcinoma or
mhm.
anything, any aldosterone secreting tumor. Okay, I can just do a ultrasound, and then I can further go for, if I find anything, I can go for CT abdomen. Okay.
Okay, what
Apart from
specific
this,
CT you want to do?
yeah, CT adrenals.
Okay, another CT.
Another CT for renal artery stenosis. I would like to do
Excellent.
the what is it? I am not sure. CT angiogram for
CT
renal
angio
artery
or
stenosis.
MRA? Yeah,
MR, but
CT
CT
angio or
angio is more
MRA.
specific, and you can do MRA also.
Yeah, and you can
Yeah.
do before then Doppler for the renal
Yes,
arteries.
yes, renal artery Doppler to rule out renal artery stenosis. Agreed.
Okay, okay. So, uh, if what else in the history
Mhm.
put him risky to be hypertensive related or cause his blood pressure, high blood pressure,
He's got
something
family
great
history positive.
habit
His mother and father has had
apart from family history. Yes.
okay. He's eating from outside. Okay,
Okay,
and
the
he's
food
got a long
itself. Okay.
driver. He's driving himself a long time, so he's sitting for too long.
Hmm.
And what else?
Risky behavior.
Yeah, risky behavior. Yes, he's taking some occasional drugs.
Yes.
So this
Excellent.
could be one of the reasons for his high blood pressure also. That's why I just
Yeah,
wanted
and
to go
you,
into the details what type of drug he's taking. But he says
yes, you
occasionally.
should ask
But it could be
in
one of the
details
reasons. Yes.
what
Yes,
are
you are
they.
right.
Yes.
Yeah.
So this could be the reason of resistant
Yes.
hypertension.
Yes. True.
However, it might be also occasionally, and
Still,
if you
you
rule
are right.
out, so yeah, still our
Yeah.
differential will be valid for
Yes. Yes.
essential, right? Okay.
Essential habit.
How to manage? Last
Okay, so
question.
management, yeah, it's non-pharmacological and pharmacological. The first thing is very important to educate and counsel the patient about his condition. The second thing is to tell him about the lifestyle modification, the exercise, refer him to a dietitian for
Excellent.
a dietary program, an exercise program. And thirdly, he should stop smoking and stop the amount of alcohol, whatever he's taking. He should be referred to a multidisciplinary team in the form of a cardiologist, and a nephrologist, and an internal medicine doctor. He needs to follow an ophthalmologist also because he is having the changes in his eyes to further follow him up for that. And because it's essential hypertension, so he needs regular follow-up with nephrology, cardiology, and ophthalmology. Apart from this, he should stop driving and inform DVLA about it. Okay, and then we come to the pharmacologic decreased weight. Okay, and uh, uh, apart from this pharmacological medication, first of all, if I'm thinking of essential hypertension, I would start from, because he's less than 50, so I would like to start him from, I think it should be ACE inhibitors and ARBs. The second line, if not still not controlled, because start him on calcium channel blockers. If still not and no other cause is found out, it's typical essential hypertension, we can push him to diuretics.
Okay.
It's a multi-regime, and he should be followed with a specialist for this,
Excellent.
like a cardiologist.
Okay. The last question, sorry. What the investigation you want to add if you suspect metabolic syndrome?
Okay, so metabolic syndrome, if I'm suspecting, I would like to add fasting blood sugar, HbA1c.
Excellent.
He's young, so I
Excellent.
need to put lipid profile for him also. Okay,
Excellent.
and this is what he needs. Okay,
One more test. One more last.
Non-alcoholic fatty liver disease also as well metabolic
No,
syndrome.
no,
I'm not
for the
sure.
metabolic syndrome. Yeah, what
The
test
diabetes,
you
hypertension, dyslipidemia.
and
Uh, I'm not sure.
and uric acid.
Yeah, uric acid.
Okay, perfect. Thank you, Dr. Rabia.
Well,
Yes,
thank you very
I
much.
think, yeah, I think no comment. You did the case
No,
from
no,
A to Z.
you have to comment.
Really? Okay, the comment,
Yeah,
the
please.
onset course, the previous, the
Mm,
introduction, the system review.
mm,
This case, this type of case, you have to put the differential in a corner,
mm. Yes.
and you will roll out every cause by
True.
a specific question.
Mm,
As you
mm,
did exactly,
mm,
you rolled
mm,
out the cardiac causes,
mm.
you rolled out fucocytoma. However, you can add sweating only, plus the
Yes, true.
anxiety to the
Mm,
shakiness. Okay,
mm, mm, mm,
so this is a particular question for fucocytoma. The attacks of headache, is the headache
mm.
coming in attack or not? So fucocytoma, first screening. Then
Yes.
metabolic syndrome, you ask for the BMI excellent.
Mm.
And you can particularly ask if you have history of high blood sugar, not
Okay.
only you have
Tamam.
any medical lasting disease or any medical history before.
Tamam.
Okay.
Okay.
Then the most important also here, the cardiac causes,
Yes, true.
to rule out like aortic stenosis or
Yes.
coarctation
Oh,
of
completely.
aorta,
Yes, Dr. Kavirota.
and this one you will roll it out by examination,
Yes.
radio femoral
Mm,
delay or radio
mm.
radial delay. Another one you can put also the Cushing as you did, and you can roll
Mm,
it out by either question for Cushing, the
mm,
interscapular fat, or
mm, mm,
the bruising of the skin, or uh, overweight in certain area like the face, and also you will find high blood sugar. For the polycystic kidney, for example, if you have family history of any
tamam.
kidney disease, you can ask
Mm,
either you have any history of kidney disease,
mhm.
or
Specifically. Tamam.
yeah, or any flank pain or any
Mm,
blood in urine
mm,
hematuria.
mm.
These are the most system will be causing hypertension. Renal
Okay.
artery stenosis is one of the causes, but you can roll it out by the only auscultation. You can't ask for
Yes,
unless
true.
there is, yeah, yeah, also the forestness of the urine can be one of the presentation of renal artery stenosis. So
Tamam.
this is another question.
Mm,
Okay, let's go to the external factors like
okay.
the diet.
Okay. Yeah.
That's why you ask for the diet. Yes,
Uh-huh.
great to ask about. Yes, how is your diet? So the junk food, one of the reason could be
Mm,
salty food,
mm,
and you
mm.
can also add some licorice, which is herbal. It
Yes,
could be
licorice,
the
herbal
reason.
medication.
Yeah, are you taking any herbal medicine
Mm,
recently?
mm.
This is for the diet.
Yeah. This is very important
Uh,
because herbal medication.
yes, the recreational drug you screened it,
Mm.
but you didn't
Yeah.
ask more.
True.
You
True.
found that he is taking, so you can ask more question. What's this
Tamam.
drug you are taking? Is it cocaine or amphetamine or whatever? So it will be a reason if he is drug abuse. And you should ask also what the way you are taking this drug. Is it sniffing or injection?
Yes, very
And if
important. Yes, you're right.
yes, because yes, if like that and he's taking by injection, you should think
Yes,
about infective endocarditis, and the
extremely.
also the
Mm.
advice will be against, or you will advise him for this risky habit, which is
Yes,
sharing needles and
yes.
HIV risk.
Mm, mm.
Uh, what else in the possible causes? So yeah, if you roll all these out, you could think about the essential. Don't forget the white coat syndrome. How
Yes,
to
yes.
ask it? Yeah, did you measure your blood pressure at home?
At home. Yes.
Yeah, did you
Mm,
monitor your blood pressure at home?
mm,
Just roll out
mm,
white coat syndrome.
mm. Agree.
Okay. The family history, of course, for the essential, going more with the essential,
Mm,
travel, nothing relevant
mm,
here.
mm, mm.
The compliance to the medication itself, you didn't ask
Mm.
if he's taking amlodipine compliantly or no. He might be not compliant and just
No, but I asked
is
you. I said, are you compliant? You said yes.
yeah.
I've
Okay,
went
okay,
from 5
great. If you
milligram, takes
ask,
to 10
okay,
milligram.
okay,
Yes.
great, okay, okay. The vision, the weakness, all these questions as a
Mm.
complication, chest pain,
Yes.
awareness of heartbeat.
Yes. True.
If there is arrhythmia as well, you could think
Mm.
about HOCM and
Yes. Yes.
aortic stenosis.
Mm.
So this is in general how to screen, and you did it all of them, but maybe not in the differential way. You did it in the
You're
system
right.
review.
Yes.
Yeah, one
True.
more thing you didn't ask,
Hmm.
which is the endocrine for hyperthyroidism. This is missed.
Yes, I missed. I just asked about the
Yeah,
weight, and I did not ask about any other thing. You're right. Cold
excellent.
intolerance or weight
Yes.
intolerance. You're right.
So you
Yes.
can ask only one question.
Mm.
Are you
Mm.
intolerant to any weather? You
Mm.
cannot tolerate the hot
Okay.
weather for
Mm.
thyrotoxicosis or hyperthyroidism. Apart from this, you did all the history perfect.
Mm.
The rash itself, yes, I agree for the rash. Why rash here is important? Why rash in hypertension is important? Rash. What do you
No,
think?
um I was thinking of
Cushing?
autoimmune diseases also. Like Cushing can give you a
Vasculitis?
rash,
Okay.
vasculitis in patient, right? Because it could
Mhm.
be glomerulonephritis, vasculitis,
Polyarteritis
causing you
nodosa.
yes,
Yeah.
polyarthritis nodosa. Yes, these are my
Okay.
differentials also. That's why.
What disease with rash, specific rash associated with
Mm.
hypertension? But
Rash.
if you see this patient, you will diagnose this from the look, spot
Mm.
diagnosis.
Mm. Mm. Mm.
What do you think? Neurofibromatosis, for example?
Neurofibromatosis, yes, because once you see him
Yeah.
spotly, it's could be one of the complications. Neurofibromatosis is something
Yeah,
we have.
it will be associated with pheochromocytoma as
Yes,
syndrome.
as
Okay.
renal stenosis, yes.
Yes, excellent. Systemic sclerosis, yeah, fluorescence of the urine and other autoimmune manifestation of the systemic sclerosis. So it's a
Mm.
wide differential, but take
Mm. Mm. Mm.
the
Yes,
commonest, then the less common.
yes, true.
And when you roll all these out, you could
Mm.
reach to the essential hypertension.
Mm. True.
Okay. Good to know
Mm.
about the smoking, the alcohol, and the
Mm.
driving.
Mm.
Very important to
Yes.
ask and to advise immediately
Mm.
because if you forget, you might
You will
be,
forget. Yeah.
yeah, forget at the end. Okay, the
Mm.
examination as you did started from the hand,
Mm.
the pulse, pushing the easy bruising. It's no specific, but you can screen the whole hand for any pulmonary edema, for
Yes.
yeah, other causes. I don't think you can find something in the hand
Mm.
specific for disease.
Mm.
Apart from metabolic syndrome, glucometer or finger prick
Yes.
check
Very much.
for yeah diabetes. Then the pulse in both hands, radial I mean, and any radio-radial delay, very important for
Mm.
uh,
Mm.
coarctation of aorta.
True.
Then the checking blood pressure, how
Mhm.
much,
Mhm.
and
It's very
for the
important to see in
face,
both arms. Yes.
yeah,
Yeah.
the face I think also nothing specific apart
Yes.
from Cushing manifestation or Cushingnoid feature. Yes, the hand, yes, very important. The acromegaly,
Mm.
you did it.
It's very
I missed, but you did it. Any
mm.
change of the hand size or
Mm.
the ring size,
Mm.
acromegaly, one of the cause should could be in the differential and should be screened.
Mm.
Okay.
Mm.
The heart examination, you will do
Mm.
full heart examination for the apex
Okay.
with the hypertension. What do you expect the apex will be? Is
If
it
I'm
in
thinking of
place?
hypertension, yani it should be I think it
Yes.
will be displaced because left ventricular hypertrophy
Excellent.
can cause
Yes, it will be displaced outward.
displaced apex yeah. No
Yeah.
specific character, but it will be displaced.
Yeah, at least it will be displaced.
Yes, it will be
Okay.
displaced. Mm.
I think with regurg, it will be displaced outward, downward, but
Yes.
with
Yes.
hypertrophy, it will be outward.
Yes.
Okay, then the murmur to roll out any out stenosis, or
Mm. Mm.
for
Mm.
example, HOCM also can be, but you will have another clause for HOCM,
Yes.
not in this case.
Mm.
This
Mm.
is for the heart examination. Congested neck veins for heart failure signs, it
SVC.
might be
Yes.
there. Yeah, and the back also fine basal crackle, and the abdomen also here is very important to do
Mm.
examination for
Mm.
multiple
For
kidneys to rule out polycystic kidney, renal artery stenosis by Berui, rule out renal artery stenosis, and a cushingoid also in the tummy, stria, for example,
Mm. Mhm.
interscapular fat.
Mm.
Then in the leg edema for heart failure as well, or the kidney
Mm.
affection as nephrotic syndrome or renal artery
Mm.
stenosis. I think you cover all this differential, and the screening, you will do a screening for all causes. Whenever you have all results negative, so this patient will have what's called essential hypertension.
Essential hypertension.
Yes, but he should be also rolled out the recreational. It's not regularly
Yes.
and no overdose, and no other also possible trigger to be in the case. This is the case today. Thank you, Dr. Rabia. You did it perfectly. Even the investigation, the follow-up, the multidisciplinary team, you cover all the team, cardiologist, nephrologist, ophthalmologist for retinal, and yeah, the fundoscopy was important here. You did it. I think nothing to be added from my side. I think there is also more comments. We can almost 14 comments. Okay, so it means the case is very fatty, fatty case.
Yes.
Yeah, yeah. One of them, the screening also lipid profile you did from
Yes,
metabolic
we have to.
syndrome. Yes, and the uric acid as well. Okay,
Mm.
let's go from the comment. Please prepare your case.
I will write the
Write
case
it
for
down.
you in the chat box, okay?
Yes, and yeah,
Or I will
until
message
I
you,
finish.
WhatsApp you, or what? I can write it on the
Oh,
chat box. Yeah, I can write it. I will write it.
yeah, you can write. I will read the
Uh,
comment now.
okay.
Berwi, driving, renal cause, most important, metabolic syndrome. Yes, it sounds judgmental to say obese or overweight in front of the patient, say raised body mass indexes. Okay, agree. Don't say obese or overweight. How the body mass index accepted. What age his father has been diagnosed as case of hypertension. I think this make hint. Yes. Yeah, Dr. Rabia, mashallah, nice. Yes, can I ask about von Hippel-Lindau? How to ask Dr. Hadil about von Hippel-Lindau?
It's because it's
Yeah,
associated with retinal hemangioblastomas and cerebral.
yeah,
You can have some cerebellar symptoms because one Hippel-Lindau
I
associated
asked
with cerebral,
unsteadiness.
uh,
yeah,
about
unsteadiness.
cerebral hemorrhage and family history of
Yes.
cerebral hemorrhage due to high blood pressure.
Yeah.
Not only that,
Uh,
this could be happen with the hypertension itself. ICH with
Yes.
yes.
hypertension complication.
Mm.
So, but for
Okay.
the
He was
von
not having red
Hippel-Lindau,
flag signs, So, but if you want, you can
cerebellar,
ask. Yes, cerebellar.
cerebellar unsteadiness,
Okay.
hemangioblastoma, right? So the cerebellar will be affected.
Okay.
Hemangioblastomas. Yeah.
Yeah. So the
Cerebellar
cerebellar and the cerebellar,
hemangioblastoma, retinal hemangioblastomas.
yeah, exactly. So the vision will be affected due to
Yeah.
the same uh, growth or cancers. The hemangioblastoma and the cerebellum will cause cerebellar syndrome, either ataxia, nystagmus, or whatever, according to the region. And I think von Hippel-Lindau associated with kidney problem,
Yes.
like
Yes.
polycystic kidney.
Yes.
So you will have a hint for the case.
Mm.
Okay, but the
Okay.
cerebellar once affected, you could think about von Hippel-Lindau.
Okay. Thank you.
Okay, coffee also, yes, agree, Dr. Aisha, very important. Salty food, yes. So, Dr. Rabi asked a general question for the diet regime or the diet. Uh, I mean, how is his diet? So, if he is taking from outside, so this general question can give you a hint. Okay. If you can remember of coffee, of course, better to ask particularly for the coffee. The salty food, the junk food, spicy food, yes. All this will help you to find out what could be the reason. Neurocytosis, yes, I agree. Systemic sclerosis, we asked. Thank you all for the comments. Okay, let's go
Dr.
to the
Basin, your
next.
case in the okay,
Yeah,
35 years
I
old
see.
male John. You see,
Okay, 35 years, Mr. John.
hmm.
Fever, in the clinic. Okay. Two
Okay.
minutes, then we start.
Yeah, ma'am.
Any question for the previous case? Sorry, I didn't ask. If anyone has question, he can ask. Or any comment they can add, no problem. Okay, I'm ready.
You can
You
start,
can
Dr.
see the
Baza?
timer. Yeah, you can see
Yeah.
the timer. Okay,
Yeah,
let's
that's it.
start. Here we go. Hello there. I'm Dr. Mukhtar, the doctor in the clinic today. You must be Mr. John.
Yes, doctor.
You are 35 years.
Yes.
Yeah, we are here to discuss about your health issue. That okay?
Mm-hmm. Okay, doctor.
Yeah. Can you tell me more about your problem?
Yeah, doctor. I came here because my friend asked me to come. I was avoiding to come to the hospital. I'm been having the fever, high body temperature for last 2 weeks. Okay, and
Hmm.
initially I thought it's just some virus, but now for last 1 week it's continuous. So I came here today.
I'm so sorry to hear about that, Mr. John. Can you tell me more about this high body temperature? Was there any previous attack, or this is the
No,
first
doctor.
ever?
This is the
Okay.
first ever for last 2 weeks.
Okay. During these 2 weeks, do you feel the fever or the high body temperature on and off?
Yes, it's on and off. It's daily, but
Okay.
it's on and off. I take some medication like paracetamol. It comes down for some time, like 2 hours, and then it comes again. Approximately, it goes around to 37, 38, and sometimes go to 40.
40. Yeah, okay.
Yes,
So you feel it's started all of a sudden and gradually increased, or it's
yes.
like on and off?
No, it's just been 2 weeks. It started suddenly, and it's intermittent, comes and goes.
Okay. Any particular timing? I mean, in the morning, in the night?
No, doctor.
Did you notice that the fever has a cyclic increase? I mean, it's coming every certain time, like 48 hours, 24 hours.
No, doctor. I feel when I take the medication, I told you, it usually I take 2 times per day. It goes for 8 hours and then come back again.
Okay. Highest temperature was 40.
40.
Yes. Okay. Along with this, did you notice any night sweat?
No,
Any lumps or bumps in your body?
no,
Any yellowish color in your eyes?
no,
Any bleeding from any area in your body?
no,
Any sore throat recently or before 2 weeks?
no.
Okay. Before 2 weeks, you were okay totally?
Yes, I was okay totally.
Okay. You have any contact with sick person recently or before 2 weeks?
As far as I remember, no doctor.
Okay. You have any travel recently or before 2 weeks?
Yes, I traveled to Malaysia 2 weeks ago, month ago.
Okay.
I traveled to Malaysia a month ago.
Okay. During this trip, can you tell me where did you stay? In a hotel or in a tent outside?
I actually stayed, doctor, with my friends in a hotel. Okay, and that's it.
Okay. Um, did you do any hobbies during this stay? I mean, any hiking, any swimming
No,
in some
no,
lakes?
no.
Okay. Okay. Did you eat from outside, fast food, local restaurant?
Doctor, this is all, the food is all outside. So we eat everything from outside, nothing specific. Everything from
Okay.
outside.
Okay. And you have any, sorry for this question, any tattoo or any casual relationship in this trip?
Yes, doctor. Multiple.
Multiple?
Yeah.
Yeah. Is it protected?
No.
Multiple partner and not protected.
Yes, doctor.
Okay. Sorry for this question. You have any discharge from your private area?
No, doctor.
Okay. You have a regular partner apart from this relationship?
No, doctor.
Okay. Anyone in your family or your friends in the group have has the same problem or the same complaint?
Uh, as far as I know, no, doctor. We three friends. Only I am the sick one.
Okay. Along with that, you have any skin rash?
I don't have skin rash, doctor, but I noticed some changes in my nails. If you can see
N-
my nails, I will just show you my nails. Okay.
Okay, can you send it?
Yes, I
How
will
is
send
your
it now.
appetite, Mr. John?
Yeah, it has decreased, doctor. For last 2 weeks, I have difficulty. I can eat, but I don't want to eat.
And the weight? Can you change the weight?
Yes, I feel the weight has decreased for the last 2 weeks. It's just that
Oh,
my clothes have become a little bit loose. But because I'm not eating, that's why I'm thinking. And because of this fever, doctor,
okay.
I sent it on the group.
Yeah, yeah, I see. Apart from this, you have any rash?
No, I told you something in my nails. Apart from this, nothing.
Okay. Let's ask some question. It might seem for you that it's not relevant, but it can help us to reach diagnosis. Okay.
Okay, doctor.
You have any headache?
No,
Any blurring of vision?
no, doctor.
Any redness in your eyes?
No,
Any discharge from your eyes?
no,
Okay. Uh, any weakness in your body?
no weakness, doctor.
Do you feel fatigue,
Yes,
tired?
yes, I'm feeling fatigued. Tired is too much. As I told you, 2 weeks, fever, less diet, eating nothing, weight loss. So I feel fatigued and tired, lethargic.
Okay. Okay. Any difficult swallowing?
No.
Okay. Any cough?
Yes, I have some cough.
Can you tell me more about?
It's just like it started 2 weeks ago, doctor. It's a dry cough. I just feel it
Dry
comes
cough?
with the fever, dry cough. I don't have any phlegm, anything.
Okay. Any cough up of blood
No,
or any short of breath?
no,
Okay. Any tummy pain?
no,
Any change of your bowel habits?
no,
Any chest pain?
no, doctor.
Any awareness of your heartbeat?
Sometimes I feel there's awareness of my heartbeat.
When your temperature is high, a little bit, right?
Yes, when it goes, then it happens. Otherwise, it's not.
And is it regular or irregular?
No, it feels regular.
Regular.
Yes.
Okay. Any change of your water work?
No.
Any neck stiffness?
No.
Okay. Any joint pain?
Yes, joint pain I have, doctor. I feel that my
O-
joints are fatigued. I feel tired and I have pain in all of my joints, especially in my wrist
Any?
joints, my knee joints,
Uh-huh.
and my elbow joints.
Okay. Any stiffness in these joints?
No.
Okay. Any back pain?
No.
Okay. Any leg swelling?
No.
Any rash in the area in your sole, in the feet, in the down
No, no, no,
area?
doctor. No, 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 no.
Okay, Mr. John, you have any family history of same problem?
No, doctor.
Okay. You have any long-lasting disease I should be aware of?
No, doctor, nothing.
Okay, you are allergic to any medication?
No.
Any surgical history before?
No.
Any over-counter medication?
No.
You feel thirsty, Mr. John.
Yeah, I feel thirsty. I'm trying to drink water because I feel dehydrated.
And what's about water work? Is it more than usual?
It's the same, doctor. I feel it's a little bit
Same.
decreased, but I think I'm not drinking water. That's fine. Otherwise, nothing
Okay,
changed.
okay. This sensitive question, you have any recreational drugs intake
Yes, doctor.
recently or before?
Yes.
Can you tell me more
2 weeks.
about?
Yes, for the 2 weeks, as I went to 4 weeks, I went to Malaysia with my friends. As I told you, I had casual relationship. Plus, I used some party drugs there.
How you the use? It was through blood channel or by sniffing?
Doctor, please don't tell anyone because you're a doctor.
Yeah,
It was
sure.
through blood channels. Yes, please.
Yeah, this is so confidential. Don't worry about that.
Yes, it
Okay,
was through
and
blood
the
channels.
last time was 2 weeks back. Are you
Yes,
regularly
doctor.
on recreational drug?
No, doctor, it was just in the Malaysia. It was did for the first time, but we did it
Okay,
too much.
okay. Any piercing or
No,
tattooing?
no, no, no,
Any blood transfusion before?
no,
Okay. Do you smoke, Mr. John?
no,
Have you ever smoked?
never.
Do you drink alcohol?
No,
What's your job?
I am a student doctor. I'm studying.
And do you
I'm
think
doing
it
my
is
master's.
affecting your study?
Yes, doctor, I'm not going for 2 weeks to the college, so it's affecting me.
Okay, can I examine you, Mr. John?
Yes, doctor, please.
Yeah, related to regarding your studying, we can give you sick leave till we diagnose you and treat you. Is that okay?
Appreciate it, doctor.
Okay, so I will start by the vital charts. How will you by
Yes.
blood pressure, pulse, and temperature?
The pulse is 110, high volume, otherwise normal character, synchronized. Okay, and blood pressure is fine, is 120 by 60. This is his regular blood pressure. And he's running some fever, but it's like 37.8, not high grade, 37.8.
Any change from sitting to standing?
No,
Okay, any injection marks?
yes, the injection marks in his elbow, in his brachial area, bilateral.
Antecubital. Okay,
Yes,
so
antecubital.
back to the hand. Yeah, I can see this nail mark.
Yes,
Any other lesion in the hand?
yes. What do you want to
Uh,
see?
Oslar nodule.
Positive,
Okay, so splinter hemorrhage, Oslar nodule, Gerway lesion,
positive.
palmar
Anything else you want to
erythema,
see? No
clubbing,
palmaritema, no clubbing,
clubbing.
no clubbing.
Okay, yeah. Then we will go to the face.
Mm-hmm.
Sorry for this question. What was the substance you are using? Heroin or amphetamine
It's for
or
heroin, doctor.
heroin? Okay. So I will examine the pupil. Will you
Yes.
change to the pupil?
No.
Is it constricted? Nothing.
Nothing, because it's been two
The,
weeks now.
in,
Nothing.
okay, in the mouth.
You can see some candidiasis, some whitish
Oh,
patches.
okay. In the face again, in the eye, a rough spot
How can you see the rod spots?
by slit lamp,
By fundoscope.
endoscopy. Okay.
Yes,
Any rough spot?
you can see. It's
Okay.
positive.
Okay. The any raised GVP,
No. 2 minutes left,
the
Dr. Vasan.
apex, the apex in place.
Apex is in place, but you
Any
can hear
murmur?
some murmurs. Yes, there is positive murmurs.
Okay. Over the
You can
aortic
mitral area,
or
mitral and
tricuspid.
mitral area, mitral and tricuspid.
Okay. In the kidney, can any multiple kidneys in the abdomen?
No, nothing in the kidney. No
Any signs of
paraplegia.
heart failure, file basal crackle and leg edema?
Nothing. No.
Okay, I will offer urine dipstick and for the hematuria.
Tamam.
Okay, I will.
Positive.
What's your concern, Mr. John?
Doctor, my concern is this, that I'm having this fever and missing my college. What is the cause of this fever?
Yes, I appreciate your concern, Mr. John. Um, I'm afraid to say that you might have a condition called infective endocarditis. Don't bother about the name. It's infection in the blood channel, and it might be travel to the heart, and one of the gate of the heart being infected with the bug through the blood channel when you use the blood sharing or sharing needles when you abuse the drug.
Oh,
Any
that
other
is the reason,
concern?
doctor. Oh, no, no, because I want to, you mean the drugs I used was the reason for all this?
Mostly, yes. When you use the needles, it might be infected with the other person, and or it might be from the skin when you inject the medication and it is enter through the blood channel to the blood and then to the heart.
Can I be cured, doctor? Is it a treatable condition? I'll
Yes,
give you a
if
minute, Dr. Vasan, okay?
yeah,
Mm.
okay.
Mm.
Once treated earlier, it might be
Mm-hmm.
cured one, and you might live near normal life. However, we should screen also for what's called HIV. Do you hear before about HIV?
Oh, yes, doctor. My friend some told me that maybe I had it because, I had this uh,
Yeah, I'm afraid to say that
bad
yes, you
behavior
might
in
have also
Malaysia. That's why.
HIV, and we should screen that after your approval. Is
Okay.
that okay?
You can give me some medication, doctor. I understood, doctor. Thank you. You can give me some medication. I want to go home.
Uh, and I appreciate your concern, but I'm afraid to say that you must be admitted, and we should inform some office responsible for the public health, and we should give you blood channel medication, antibug, for around 10 days. You have any other concern?
10 days, doctor.
2
Okay.
weeks.
Thank you, doctor.
Okay.
Okay, doctor. Thank you.
Okay.
Okay, Dr. Vasan.
Examiner question.
Go
Yes,
to
yes.
examine your questions. Okay, can you present your case, please?
Yes, young man with
Mm-hmm.
the risky habits
Mm-hmm.
came with a complaint of fever for the last 2 weeks, along with the history of cough, which is dry cough,
Mm-hmm.
positive travel history to Malaysia with a history of sharing needles and injection of some recreational drugs, which is heroin.
Mm-hmm.
Along with that, he's having casual relationships which were unprotected in the last
Mm-hmm.
month while he's in travel. Apart from this, uh, I couldn't appreciate any symptoms or signs from the history. However, in the examination, I could appreciate
Mm-hmm.
all signs of infective endocarditis in the form of
Mm-hmm.
Genway lesion, splinter hemorrhage, osla
Okay.
medulla rough spot,
Mm-hmm.
murmur
Mm-hmm.
over the
Mm-hmm.
mitral area and tricuspid valve,
Okay.
could be mitral regurg or tricuspid regurg or both,
Mm-hmm. Mm-hmm.
fever as well,
Mm-hmm.
hematuria.
Tamam. Okay.
Yes.
So your top differential diagnosis is
Yeah, on
infective
top of my
endocarditis, right?
differential infective endocarditis.
Second differential
Sec
will be
Second differential could be HIV, especially there is some candidiasis in his tongue. So
mm-hmm.
I could think about
True.
HIV, and
Mm.
yeah, in the background of unprotected sexual relationships,
True. Mm.
still HIV one of the differential.
Tamam. Baki, anything else you can put because I said no to everything. Okay, so
Yeah,
this is the
there is
top different diagnosis.
yeah. I could put also some viral
Yes, you can
pneumonias
put
because
some
he has
pneumonias, yes, or like
yeah,
malaria, even to
or
Malaysia also,
malaria,
differentials,
chlamydia
yes.
infection, or
Yes.
legionella, sorry, legionella
Yes.
pneumonia
Oh. Mm.
from the AC
Yes.
during his stay in the hotel.
Yes. Okay. Tamam. How will you investigate this patient as a case of infective endocarditis?
Yeah, apart from basic workup for CBC, looking for
Mm.
leukocytosis, inflammatory
Mm-hmm.
marker CRP, ESR,
Mm. Mm-hmm.
procalcitonin, and
Mm-hmm.
cardiac enzymes,
Mm-hmm.
troponin, BMP, if I suspect heart failure.
Mm-hmm.
Then blood culture from two separate time, I mean, or place, and apart 12 hours between two
Okay.
blood sets.
Okay.
Uh, other investigation, blood, liver function test, kidney function
Yes.
test, blood in
Mm-hmm.
urine, and creatinine, albumin creatinine ratio
Mm-hmm.
for proteinuria, and that's it.
Tamam.
Yes, other tests will be
Yes.
ECG, echo,
Mm-hmm. Mm-hmm.
to confirm the finding on the heart, valvular
What would you
lesion.
like to see in the echo?
Yeah, I could see the lesion, disease
Mm.
lesion, like valvular affection, like mitral or tricuspid regage. I could see also
Okay.
vegetation over the valve, but it could be much
Good.
clear with the transesophageal echo.
True.
And to confirm other finding in the heart and the
Okay.
systolic function, to assess the systolic function as well. It might be
Okay.
impaired.
Tamam. How will you treat this patient? Just think about that this patient has definitely doesn't have any surgery before. So how will you treat this patient?
Yes. Uh, Admission first, or
Mm-hmm. Mm-hmm.
in the acute state, ABCD approach in the patient's
Yes.
vitals, hemodynamics,
Mm-hmm.
and if he's short of breath, saturation affected, I could
True.
put him in oxygen, and for
Mm-hmm.
the circulation, I could start him in fluid, crystalloid. After taking his blood cultures, I could start him in antibiotics according to guidelines and protocol in the hospital for bacterial endocarditis, infective endocarditis.
Tamam. What is
So
the most common organism involved for endocarditis?
yeah, the most common in his case will be Staphylococcus aureus,
All
being
right.
his
Usually,
drug
which valve is
abuse,
affected more?
the tricuspid the side of the heart, tricuspid lesion or tricuspid valve.
Okay. Okay. So do you know any if there's a naive valve endocarditis, what we can give? If it's Staphylococcus aureus, any idea of the medications? Any names of the
Yes,
antibiotics? Mm.
yes, starting by vancomycin
Okay.
along with the fluoxetine,
Mm-hmm.
and if there is the prosthetic valve, I could add rifampicin
So you'll start
since he
first with
has no.
fluoxetine because it's naive. Okay, so no need to add a double cover. You start with
Okay,
fluoxetine. If
so
this patient is sensitive
yeah,
to it, resistant to
fluoxetine,
it, then Venco.
yeah, yeah,
Then Venco and
fluoxetine, yes, you're right.
Valproate. Okay, tamam.
Mhm.
For how long you will give it? Usually, duration of
For two
medication
weeks.
for 2 weeks. If not benefited, and what is the criteria of doing a surgery in a patient with infective endocarditis?
Yes, if resistant to the medical treatment,
Mm-hmm.
he is indicated for surgery. If there
Mm-hmm.
is aortic root abscess, he is indicated for
Okay.
surgery. If
Mm-hmm.
severe symptomatic heart failure and tricuspid
Yes.
or valvular
Yes.
regurg,
Mm-hmm.
yeah, or atypical fungal infection, also one of the indication for surgery.
Tamam.
If the patient has any cardiac problem, he might be indicated for surgery.
Tamam. Do you have have any idea about the criteria of infective endocarditis?
Criteria, yeah, Duke's
Yes.
criteria. So
You can tell me.
should be
Mm-hmm.
yeah diagnosed by two major.
Mm-hmm.
or one major, so three minor or five
Tamam.
minors.
Tamam.
Okay, so the two major, either blood culture for echo
Mm-hmm.
finding.
Mm-hmm.
Blood culture, one of the known organisms for infective myocarditis, or finding in the echo,
Mm-hmm.
like regage or
Tamam.
vegetation.
Excess vegetation. Tamam.
Yeah,
Okay. Minor criteria.
minor criteria including the aortic, sorry, the AV block, high temperature,
Mm-hmm.
other autoimmune complex like
Yes.
hematuria,
Yes.
pneumocolitis, oslar nodule,
Yes. Vascular phenomena like GNV lesion, immunological phenomena
genuine
like
lesion,
of
yes,
the node, fever, predisposing heart conditions, and microbiological evidence. Tamam.
atypical organism, yes, HASIC.
Thank you very much. And you are done with the
Yes.
case.
Okay, thank you, Dr. Rabia. Thank you for the case.
Tamam, Mr.
Just,
Basin?
yeah,
Yes.
comments, please.
Yeah, you did it really well as usual. Mashallah, you have good knowledge and good way of presenting the cases. You asked everything about the fever. So starting from onset, duration, course, you did everything for that. Okay. And you asked about the night sweats, the morning time, the daytime, and what specific time of the day you have, because definitely malaria and certain types of typhoid, they have cycles in which certain type of fever comes. Okay. And usually you did not ask about chills and rigors. You asked about the night sweats, but night sweats usually associate with TB, but definitely you should ask about chills or rigors also. Because in infective endocarditis like malaria, there are chills and rigors.
Mm,
Okay. Tamam. Bagi, you
yes.
ruled out everything from the top to bottom. You asked about conjunctivitis for fever. You did not about any air discharge. Otherwise, you ruled out meningitis also by asking about the neck pain. You asked about the headache. I did not tell you purposely about the headache because otherwise differentials would be meningitis. Tamam. So, no headaches. You asked about the neck pain. You asked about the chest symptoms. You asked about the tummy symptoms. You asked about the urinary symptoms. You ruled out every cause of fever. Okay. Sama,
Mhm.
and it was you asked about the
Dr. Rabia,
travel history,
your
which was
mic,
very important because
your
all
mic
the
is,
connection was coming from the travel history.
can you adjust your mic, Dr.
So
Rabia?
you asked about the
Dr. Rabia, your mic. Yeah, the sound is interrupted. If you can adjust the
your mic
mic,
is not
please.
well.
Yeah,
Come on,
interrupted one.
come on, you can hear me.
Yes, yes, now clear. Yes, go ahead.
Okay, okay. So you
Sure.
asked everything very well, Dr. Basan. You scanned for the fever completely from top to bottom. You asked about the headache because you want to rule out meningitis. You asked
Mm-hmm.
about the, sometimes you can ask about the photophobia also. You did not ask, but it's okay.
Mm-hmm.
Headache is more than
Perfect.
enough.
Yes.
Neck pain. You asked about the conjunctivitis. You did not ask about any air discharge because sometimes, you can have infections from the air also causing high grade fever.
Yes, you're right.
Apart from this, you asked for the chest completely, the cough and the shortness of breath and the tummy symptoms. You asked about the diarrhea, about the urine. Uh, the best thing was that you asked about the travel history because I was waiting for that, and all the behavior came from that. The travel history,
Mm.
the sexual behavior, and the IV drug abuse, and you asked about the drug abuse very correctly, Tamam. Okay, you did not
Mm.
ask me if I'm taking any medications currently, Tamam. I told you
Mm-hmm.
myself that I'm taking paracetamol. You did not ask about any over-the-counter medications. You should have asked, Tamam.
Mm-hmm.
You asked about the history, smoking, alcohol, job, driving. I'm not sure you asked or not. I'm not sure about it,
No, I
Tamam.
didn't ask, but yeah, why he will be affected
No need,
the
no need,
driving?
no need, no need for
Yes,
driving. That's
yes,
why
yeah,
you did it
yes.
right. No need for driving.
Mm-hmm.
Tamam. So history was completed really well. It's a fever. So fever, you have to rule out everything from top to bottom. Okay.
Mm-hmm.
Tamam.
Okay.
Differentials you discussed well. Examination was good. Tamam. But the same. Splinter hemorrhages. First, you have to give a general look to the patient. Is he dehydrated? Does he look cachectic? Does he look pallor? Okay. You should have asked, do you look more
Mm-hmm.
pallor than usual? Tamam. Anemia. In the hands, osseous node, GNV lesion, you ruled out everything. Pulse was very important. High volume, character. Tamam. And then the signs of the pricks for the needle. And then for the, you asked, you should check for the muscle wasting also, Tamam. Muscle wasting in the
Mm-hmm.
shoulders, muscle wasting in the hands. Because for last 2 weeks, he's not eating anything, very less, and he's got high grade fever. Tamam? And anemia, jaundice, you saw cyanosis, candidiasis, you saw in the mouth. Nose murmurs are very important because he's having this tricuspid and mitral murmur. Tamam? Abdomen was good because you need to rule out signs of fever. So you need to look for tenderness, for hepatomegaly, for splenomegaly. It could be one of the causes of malaria. Okay. So you have to see from
Yeah.
splenomegaly, hepatomegaly. Okay.
Also
If you don't have
splenomegaly
time, you
with
could
the infective endocarditis. Yes,
yes, yes,
can
yes.
be.
Also, you can just inform
Hmm.
the doctor there that
Offer. Yeah.
offer that I would like to do the abdominal examination without splenomegaly
Hmm.
because
Yeah.
this is the cause of fever. If
Hmm.
Tamam, that's it. And you did the dipstick urine for hematuria, proteinuria. That's great. And pedal edema. Tamam, management was very good. Concerns were very well answered. Only time was because this was a big scenario and I was saying yes to
Hmm.
everything. That's why purposely I did not say smoking alcohol because I wanted you to move. Okay. Uh,
Hmm.
Investigations were perfect. We did the basics investigations. The echo is very important for this. The blood culture is very. You can also ask for urine analysis, urine culture,
Hmm.
and for chest X-ray also. This is very
Hmm.
important because we are sure about infective endocarditis, but we need to rule out other causes. Uh-huh.
Yes.
Okay. So chest
Yeah, sure.
X-ray, and you did not check for the lymph nodes. This is very important for lymphadenopathy
Yes. Yeah, you're
because
right.
long fever. Okay, so it's very important for lymphadenopathy. It's one of the differentials could be Hodgkin's lymphoma also. Tamam?
Yes.
But the fever history will be prolonged, like 4 weeks, 6 weeks, and there will not be too much behavior like this. Otherwise, it would be one of the differentials. So lymphadenopathy is very important. Even viruses, even infections, lymphadenopathy should be ruled out. Tamam. Baki management was
Hmm.
very good. ABCDE. ABCD is very good. Multidisciplinary team and management of the symptoms, non-pharmacological, advice to stop the behavior and protected sexual behavior, no need for drugs, and hydrate himself well, admit him first of all, and medications the same. According to we'll send the cultures and wait for the culture for the time being before the cultures appear. And because this is naive valve endocarditis, so we should start him on amoxicillin and gentamicin because we don't know what is the organism. If it's still not working, he's not responding, then we can add vancomycin and gentamicin. But because I told you Staph aureus, so we can start with fluoxetine only. And then further, we can push to vancomycin and rifampicin. So this
Hmm.
is for naive valve endocarditis. Bagi general measures and the criteria is very important. Uh, if you have rotabasin, the surgery, what is the most common organism in the less than 2 months? If you
Yes.
have surgery of the valve,
Staphylococcus epidermidis.
yes, epidermidis. If less than 2 months. If more than 2 months, it's the same Staphylococcus aureus.
Yeah.
Tamam? And that's it. The indication of surgery, you did it very well. Khalas, this is my comments. Well done, Tamam.
Yeah. Thank you, Dr. Abia.
You're welcome.
Yeah.
Anybody,
Actually,
any comment? Let us.
yeah. Yeah. Any comment? Any question?
Well, Qasim, I think in the management you mentioned something about public health.
Yes. Uh, yeah, it's not notifiable. Yes, you're right.
Yes, it's not
No need,
notified.
right?
Yeah,
Yes,
yeah, yeah. You're right. Yes, yes. Not notifiable anymore. I mean the HIV, but yes, you're right.
yes.
Okay, yes, you're right, doctor. Thank you.
Okay.
Any other comment? Okay. Why more comments in my case and in this case, no comments? Is it clear? Why no interaction in this case? Seems the case was clear. I didn't get it unless from the picture. Even the picture wasn't that much clue for me, but yeah, it does help. All mention. Okay, thank you, Dr. Heidi. Yeah, but you should interact even. I'm not looking into the chat while practicing, by the way. I'm trying to hide or not to look to the chat. So anyone can chat it just to be more interactive. Okay, so it's clear from all and it's clear for all. Thank you, Dr. Hadid. Thank you all. Thank you, Dr. Rabia. Yeah, it's nice day and nice two scenarios. Yeah, I think it's so so fatty session. Yeah, it was. Yes, you're right, Dr. Aish. Both are the same topic. Yes. Okay. If no more question, no comment, we can end the session and see you tomorrow, inshallah, with the communication day. Thank you all. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.